Following segment is sponsored by Bayer. February is American Heart Month, and with heart disease being the leading cause of death in the U.S., it's so important to understand what we can do to protect ourselves. Joining us now to discuss from Bayer is Senior Medical Director Dr. Alana Morris-Simon. Welcome to the show, Doctor.
Thank you so much for having me.
Yes, of course. Okay, when it comes to heart health, what's the difference between risk factors we can control and those we can't?
Sure. Well, it may be easier to talk about the things we can't control. So these are risk factors like age, family history of heart disease, sex, as well as race and ethnicity. Fortunately, there's a long list of factors that we can control. So these are things like diet and exercise, making sure that we stay away from products like tobacco, minimizing alcohol, making sure that we're getting good sleep at night, and finally trying to minimize the amount of stress that we have in our daily lives.
Okay, good to know, good tips. And do you have any practical tips for people looking to improve their heart health?
Sure. So, for example, we probably can all make changes to our diet, changes like increasing the amount of fruits and vegetables that we take in and minimizing the amount of red meat, saturated and trans fats, and ultra-processed foods. We also want to make sure that we exercise. We need to move our bodies as much as we can. So going to the gym, but even small changes like going for a daily walk or taking the stairs at work rather than elevators and escalators. I mentioned the importance of good sleep. We want to make sure we get anywhere from 7 to 9 hours of sleep every night. We want to make sure that we're minimizing the amount of stress in our lives. And then finally, so important, don't smoke, eliminate tobacco, and really try to minimize the amount of alcohol that you're taking in.
Oh, also crucial. Okay, we know that certain groups are at a higher risk of heart disease than others. What's the reason for higher risk, and what advice would you give to these more vulnerable groups of people?
Well, sure. Again, even though heart disease is the #1 killer of all Americans, there are certain groups who do have an even higher risk. So, for example, Black Americans have the highest risk for developing heart disease, the highest risk of dying, and that's in part because of the role of high blood pressure in this group of Americans. We know that women, for example, often have more difficulty getting their heart disease detected and diagnosed. There are important delays in diagnosis for women. And then finally, we see that rural Americans are starting to have a higher risk of heart disease, in part because of more high blood pressure and diabetes in rural parts of America, but even more important because of lack of access to doctors for good preventive care and lack of access to hospitals.
Okay, now are there any resources that can help people assess their heart health?
Sure. Bayer, for example, sponsors a heart health risk assessment tool that anyone can find at seeyourrisks.com. Again, that's seeyourrisks.com, and this is a quick, easy 2-minute tool that you can use to assess your individual risk factors. But it's important to circle back and talk with your doctor to make sure that you're managing those risk factors in the best way that you can.
Yes, oh, also important. Thank you so much. Where can we go for more information?
So again, that tool can be found at seeyourrisks.com. That's seeyourrisks.com.
Okay, thank you so much for joining us today, Doctor. Great to see you. Have a wonderful day.
Thanks so much for having me.